Last time we were talking about the history taking, and as I told you repeatedly, history taking, if you do nicely, 90% of the diagnosis you will get. 90%. Well, it depends again on how much time you got, how busy you are, how much time you can devote to any patient. So you can make it short also. Now, we talked about appetite and all that in personal history last time, and I'll take a few minutes to finish up the topic before we start with the chest pain. So you're supposed to ask about the sleep. Is it good sleep? How many hours? Now, on this point, I am not very confident that everybody thinks that 8 hours sleep, solid sleep is important for a good health. In these modern days, I don't think it applies, in my opinion. It could be wrong. I mean, 8 hours is 1/3 of the day. So if you are going to live for 60 years, then 20 years you have spent in your life only sleeping. Then it becomes difficult in the modern life to continue. In my opinion, and there are other people who say 3 to 4 hours sleep is enough. And I think it's individual. It's highly individual. There are people who sleep only for 5 hours, 6 hours, and they're very healthy, very healthy. There are very busy people who sleep even less than that, 4 hours. They're very healthy. So you can ask about the sleep. We are mainly interested in snoring. People who snore at night, snoring has to be clarified, gone into deep. A little bit snoring is common for everybody. But people who snore very deeply, loudly, and you can make out that, the neighbors say they can't sleep. And in the snoring, deep snoring, stop for a moment. Again start snoring. That is a dangerous snoring. And I told you once that for snoring, if you turn your sleep on the lateral position, the ordinary snoring disappears. And only if it is a big snoring, then you have to think of sleep apnea syndrome. People who are feeling drowsy in the morning, there you can go deep into it. Afternoon nap, you can go. People who say that they don't get sleep at night, less sleep, you have to make sure of two things: that they don't sleep in the afternoon. Because if you sleep in the afternoon, then naturally your sleep at night will be less. And second thing is exercise. Those who do regular exercise will definitely get a good sleep. So this is about the sleep, the mental health. And let me tell you one thing. When I say mental health, today all patients of yours, 1/3 of their symptoms, they have got an organic disease, there is no question, which is responsible for most of the symptoms. But some of the symptoms of patient are due to poor mental health, depression. Now, when I say depression, in the modern days, COVID going on, there is no income, there is no money in the house, what do you expect? Everybody will be depressed. But that should be forgotten. You should go for this, that person in normal circumstances, early morning he feels low. He doesn't feel like going to work. Person with normal means his food is normal, money is normal, income is good, everything is good, all the happiness in the world. But he doesn't feel like going to work. He feels low, he feels weak. Occasional crying spells. For no reason he will start crying. For a small reason he starts crying, which he never did before. All these are symptoms of organic depression. That means this patient needs some pill to get rid of the depression. So this mental health really becomes in every patient. In some patient maybe less, in some patient may not be nothing, maybe possible. So unless you ask for these symptoms, you will not diagnose depression. By X-ray, by blood test, by CT scan, you can't diagnose. MRI of the brain, you can't diagnose. Only by asking, history taking, we call it. Similarly, people who have a lot of tension, anger, is important, and then having hypertension on the top of that. So, most of the patients, when they come and you start asking them the history, that how old are you, they first show you the reports which they have done all, or they have spent about 10,000 rupees. They show you. Don't look at these things. Just throw it away. Start again. How old are you? How many children? See, this is going to misguide you. And this has already misguided the other doctors. They have already created a fear in his mind. So suppose uric acid was high, then they say, oh, you are going to get gout. So don't eat this, don't eat that, don't eat prawns. Wrong. Wrong. Just don't see the investigation. Investigations have to be seen last to confirm your diagnosis. What you think, what you thought of. Iatrogenic. 10% of all the complaints on an average are iatrogenic. Iatrogenic means what? Either they are produced by the reports. He is in, uric acid is gone in his head. So he starts imagining. Or more likely, drugs, side effects of drugs. There is no allopathic drug which does not produce side effects. And to remember the side effects is difficult, very difficult. So now you have got this mobile, then 1 milligram is there. You press 1 milligram and in 1 second you will get all the side effects of every drug which he is taking. And when you go through, you will pick up some symptom which he is complaining of due to the particular drug and omit that drug. I told you last time also, so often I get patients with peculiar symptoms I can't identify with an illness. I go through 1 milligram, or if I haven't got, I stop all the drugs for 3-4 days, nothing will happen, whether it's blood pressure, diabetes, and see if that complaint has gone. Constipation is a very common complaint due to the drugs. So see the list of all the drugs which he is taking. Most of the doctors spend so much time on the diet. What do you eat? How much you eat? What do you eat? Salt, sugar. That much time should also be spent on exercise. On how much patient does exercise. Find out. Does he walk? Or he is only in the car? Or only in the buses? For the bus stop. Is the bus stop next to his building? So there is no walking. In fact, he should make a habit of going to the next bus stop. So at least some walking is done. When he goes in the building, in the offices, does he take the lift? No. Use the steps, climb. See, if you are going to a building or 7th floor, 8th floor, and if you have gone 3-4 times, you have to go in that building. If you can just climb the steps, it's a very good exercise. And even while coming down, don't use the lift. Coming down the lift, even 7-8 floors, is an exercise. So, every patient's history, you have to see how much does he exercise. Prayers. And it's a very difficult question, a very secretive question, to ask somebody. You need guts to ask. Then, do you pray? Do you pray? Do you pray? That question is so personal. And somebody asking you, only a doctor can do it. Only a GP can do it. On the police station, nobody will ask you. So when you must say, does he pray? Number of people will say no. And then praying doesn't mean you go, of course there are different types of people who have, if Jain people go to the temples every day, they spend really 1 hour in the prayer. Muslim people do namaz 3 times, 5 times a day. Yes, whatever method you do, cult, people are mixing it up with the cults. Now in India is the only country where there are thousands of cults. One cult will tell you this, don't eat meat, no sex. Other cult tells you something else. And these people going to cults, you know how much time they waste. And to join that cult, so how much money you have to pay? Most of these cults are very rich. From the 6,000 crores, 3,000 crore, money is you have to pay. And then to going there, attending for 1 hour, coming back, I'm not sure how much is it useful to a particular man who is a middle class person, who has limited time. He can pray any God you have. Just sit down, spend 10 minutes, 15 minutes, and pray. The idea is he should believe in some God. You see now some of the cults are saying, what God? There is no God. Who is God? Who are you? They try to confuse you. So you do meditation to know what are you. All these things can be confusing for an average middle class person. Apart from loss of time, what money which he gives, if you have your God, any, whether Sai Baba, you can say, okay, Lord Krishna, or so, you sit in the morning and have faith in that God. Have faith in that God. And then you will be afraid of that God. If you are doing any wrong thing, that Sai Baba will come in front of you, you will not do wrong thing. So prayer is a must, there is no question of that. Because prayer will look after your mental health. What are you taking your mental health? Bhaji? Mangoes? Food? No. For mental health the food is this, that little prayer of 10-15 minutes. It has to be there is no question. And I will not like to treat any patient who does not pray, who does not want to start praying. I am telling you, I am so strict in that. And in fact I don't believe my own prescription that this will make him alright. After I write the prescription, 1 second I pray God, God please help me to relieve him. Then the prescription works, otherwise it doesn't work. So prayers are very important. Now there is one symptom of ghabarat, and this ghabarat is very common in India. Abroad I have not heard of these symptoms, not common. And this symptom is nothing else but a symptom of panic, a mental symptom, related to mental health. See this ghabarat patient, okay, he might think he has got heart disease. Okay, you do an ECG and convince him your heart is normal. So relieve him by saying that there is no heart problem, lungs are normal, your oxygen is normal, and it's a symptom of panic, so it needs a psychiatric drug, alprazolam. Now I have in my 60 years of practice, I must have easily more than 20 patients who, especially women, especially middle-aged women, ghabarat, they continue to take these tablets for years. So, and then you will say, why don't you send them to a psychiatrist? If I start sending every patient who ghabarat to a psychiatrist, then all my patients will be with the psychiatrist only. No, some of the symptoms of mental health, the GP can treat. There is no question of that. Then prognosis. Every GP must know this word prognosis. Prognosis is the same thing as astrologers who fool the public. This line means that you will live this much. This means you will get operations. This means the doctor is doing the same thing by medical knowledge. Medical knowledge. And if you tell your patient about all this, it's called a life history of all illnesses. So tell the patient nothing else but medical astrology. And medical astrology, I can tell you, is much better than ordinary astrology. So what is the meaning of this? So suppose you are treating hypertension, diabetes. Patient has got a stent, bypass done, operation, tuberculosis, obesity, migraine patient, asthma patient. Talk to them for 5 minutes. Explain to them that this is your future, that is the prognosis. This will happen to you. So hypertension patient, you explain to them, take drugs, lifetime, and if you don't take, you will one day develop a stroke, means paralysis of half of the body. You mark my word, see all patients of hemiplegia. 90% of them are those who did not take proper treatment of hypertension when they were 40, 50 years old. Yes, it's a sacrifice you are doing, agreed. You are taking a pill for 20 years, but you are preventing paralysis. Diabetes patient, give him a good lecture. Diabetic patient, even if he takes treatment, explain to him, even if he keeps, after 10 years, he will start having heart problems. 50% of the patients of diabetes have already got some mild heart problem by the time they come to you in their 10 years of history of diabetes. So common is heart in diabetic patients, so common. Patients who got stent, who got bypass surgery, they are doing maja, eating anything, drinking anything, eating. No, wrong. The surgeons have not told them, because otherwise they cannot expect to get so much money. They have to be told, this is the beginning of your illness, diagnosis. Stent has been put, operation has been done. Now, continue to treat this disease, otherwise after 10 years, again stent. After 10 years, again bypass. Explain to them. It's a lifelong process now. Tuberculosis. Patient comes with TB, they go, doctor, TB, kya hoega? Nothing, tell them, no problem at all. In 6 months, your daughter, your sister will be normal. Provided you have done a gene expert test on the sputum. See, many doctors will avoid doing gene expert. Expensive, 2,000 rupees, 3,000, 2,500 rupees is most important. It gives you the prognosis. It gives you the history, life history of this illness. How is it going to behave? Is this patient going to die? Is he going to live? Suppose gene expert test shows positive, but no to all common drugs. You can, 6 months he will be normal, this patient. Suppose gene expert show, this report comes in 4 hours, it shows those bacilli which are resistant one drug to multi-drug resistant patient will die. He cannot, especially if he is more poor, if he cannot spend thousands per day, they will all die. Obesity, explain to them. You lose weight, and then continue that program. Otherwise, obesity comes back, again comes back. Migraine patient, you will give him treatment. Don't worry, in 2-3 months you will be alright. But it's possible that after 10 years again, you might start getting migraine, because we don't know the cause. Same thing about asthma. You treat, he's alright. 2-3 months, 4 months, it's forgotten. But you have to tell him, any time in future, after 10 years, 15 years, 20 years, you might get an attack of asthma. Not only that, predict death. I was telling you, if you have to create a faith with the patient in the family. They should have faith. My doctor means everything what he says is right. How do you get this faith created? By all this what I am telling you. Now, for example, predict the death. Astrologers will talk to you, oh, you might die at so and so day. Here you are predicting the death on a scientific basis. This, most of you have not understood while you are reading this drug, etc., to be given according to life expectancy. What is life expectancy? Your doctor, the author is telling you that this drug should be given according to your life expectancy. That means the author thinks that you can predict death. Then only so average age of death 60, in the cities and all 70. Some people can live 70, 80. You predict the death, and I'll give you an example. I had a patient, middle class patient, very handsome Muslim gentleman, and very well built, very intelligent, very good job he had. He developed weakness. Now the weakness is a very dirty symptom, remember that. One day I am going to take a full lecture on that weakness. He developed weakness, so there are hundreds of tests done, no cause found out. He came to my clinic, in my clinic I take the full history, and then first thing is remove all the clothes, keep your underwear, but remove all the clothes, nanga ho jao. And I got a strong light in my examining room must have strong light, ideally daylight, but otherwise. So when he removed the clothes, then I said, I first standing, then sit down on my table. I sat down and I found his both shoulders here, fasciculation we call them, twitchings on the muscles. Moment I saw that, finish, diagnosis was over. It's a neurological disease of motor neuron disease. Anyhow, it can be confirmed by EMG. Now, I had to tell him. I said, see, I don't think you can live more than 5 years. He was hardly 45 years old. And I am telling him he can't live more than 5 years. But he was very strong and he appreciated it. So, I can't live more than 5 years now. No treatment. There are some treatment. And or stem cell implant, etc. You can try homeopathic, whatever you want to try. But in my opinion, I said, will you please come to my lecture in that Birla Hall, 1,500 people are there, 1,000 medical students, 500 GPs. And then, will you remove your clothes on the stage? He said yes. He agreed. So I took him to the Birla Hall, and when I was showing them the patient, I said, remove your shirt, remove it. So I said, see, weakness, how much money he spent for the tests, how many blood tests were done, hundreds, but the diagnosis, and the patient was being projected on a huge screen, the Birla Hall in our lecture, huge screen is there, so they could see this fasciculation beautifully, and they were clapping and clapping and clapping. This patient came to me after 4 years again. For what? Difficulty in swallowing. He said, khana andar nahi jata, khana chaba ke andar nahi jata. So now I knew that this disease has now affected his pharyngeal muscles, which means nearly the end. So I told him, I said, why don't you leave the job and go to your village. Where is your village? He said, Chiplun. Go to, who are there? He said, all my grandmother, there, so many relations are there. I said, go there, spend your time. I don't think you can live more than 2 to 3 months. He was shocked, but he accepted it. And he did it. He left the job, he left everything, he went to his village, Chiplun, and everybody, he was a very handsome fellow, well dressed, and everybody, you see, why have you left the job? Why? No, O.P. Kapoor said that I will not live more than 2-3 months. So the whole village came to know. 2.5 months. One day died. And the whole village was talking. Hey, how did O.P. Kapoor say? How did he know he's going to die like that? You know, this thing, imagine, the whole public comes to know in that village. How much faith? They say, he's like Sai Baba. They compare you to God. Another lady, one Muslim lady, very old and having COPD. So cough, dyspnea, oxygen saturation 80, 82. So I had to give oxygen. Those days there was no fashion of buying oxygen concentrators, which now because of this virus people are buying concentrators, oxygen concentrator machine, 20,000, 40,000, and keeping at home. So I used to give my machine off and on and remove. Anyhow, one day I found she was very bad. In oxygen saturation 82, 84. If you take oxygen, improve. Then I told, and she had a pulmonary hypertension. Anoxia produces pulmonary hypertension. So then I told relations, I said, इनको नानी को तुम गांव भेज दो. उधर अच्छी तरह जिएगी, नहीं तो मेरे हिसाब से वो ज़्यादातर 2-3 महीने से ज़्यादा नहीं जी सकती. She went. There was no oxygen there also available. Anyhow, but she was very happy there. And because all her, some daughter-in-law, her sisters, so much family members from Khed. She was from Khed, again Ratnagiri. She had a lovely time, lovely food, lovely tea. 2 months passed. One day in the morning, she's telling her daughter-in-law, that who makes a favorite cup of tea, the बेटी मुझे एक कप चाय तुम्हारे हाथ से बना के दो. She went to make tea. 10 minutes it took, 10-15. When she came back, she was dead. She was dead. But they were so happy that Kapoor साहब ने हमको बोल दिया कि इतना और इतना 2 महीने हमको इतना चांस मिला इनका सेवा करने का और चाय पीने की. She wanted to drink tea, but she was so fond of all these things you don't get in the hospitals, in the cities. So the whole village of Khed came to know, and they were appreciating. Kapoor साहब ने बहुत अच्छा किया, बोल दिया. Other doctors will, no, how can I tell him, they'll get afraid. No, not. So this is called faith. This is how you develop faith in the doctors. And my last lecture on chest pain was more anatomical, physiological. What are the bones? What are the muscles? Here is your memory gland, even in males, breast and all. And see, today we will put it into clinical practice, that knowledge. That means now you want to diagnose. So this is exactly like what we do in a video consultation. All of you are afraid of video consultation? No, it's very good. And when you retire, you start doing video consultation, you will get a pension of few thousands of rupees, and you will be kept busy. You will not develop dementia. Dementia occurs, people will stop practicing. Then brain has nothing to do. You become dementic. So now, in video consulting, how do you diagnose? So now diagnosis will depend upon sex. Males are more liable for myocardial heart attacks, paralysis, blood pressure diabetes. Males more. Females also, but much more of them. Similarly, age. You can't diagnose anything without knowing the age. The same symptoms in a 10-year-old boy and the same symptoms in a 70, 80 years old, different diagnosis. Family history. This even the public knows a little bit. That उनके घर में सब लोग बहुत ज़्यादा लंबा जीते हैं. It's correct. If your family history is good, you will also live long. If it is bad, you will die. Then, smoker. Once you are a smoker, 100% he is going to die early and going to develop either bad lung disease or heart disease. 100%. And there are COPD patients, when you are diagnosed, it was due to smoking, you got this, they can't breathe, they can't. Then you tell them, no smoking at all. 2 cigarettes तो मैं पीऊँगा, एक संडास के टाइम पे, एक ऐसे. You tell him, 1 cigarette you smoke, you live 1 day less. That much is bad, cigarette smoking. Alcohol. Little alcohol is very good. All over Europe everybody drinks. But you drink every day, 3-4 large pegs, bad. ODP, that word. The onset, duration and the progress. These 3, ODP means you cannot diagnose anything without ODP. How was the onset? How was? You will be surprised. I have diagnosed this in 1 minute, that the driver was driving and at a particular junction at Nepensi Road, he found suddenly bursting headache, as if something is given. Bursting headache, and then after some time he had a vomit. I said, subarachnoid hemorrhage, spontaneous, no paralysis at that time. Such is the onset important. Duration, how long that chest pain persisted, 1 hour, 2 hours, it went on for 1 day, 2 days. Progress. He was all right after 1 or 2 hours. The other patient, he continued, he developed more symptoms. So, onset, duration and progress make a diagnosis very easy. Then what is the diagnosis? If whatever you are thinking of, that test should be asked for. When you start doing video consultation, you can't say routine blood count, routine urine, SMA 12, SMA 14, X-ray. No. You have to ask for 1 or 2 tests to confirm what you are thinking of. No. We are discussing today chest pain, how to diagnose. So, what investigation will you ask? Only one or 2 out of these 12. What are the tests in chest? X-ray test, resting ECG, which I told you all of your GPs must buy a machine, 10,000-12,000 rupees ECG machine, which is nothing. You must learn to take ECG. It's nothing. All technicians only take ECG. And reading ECG, very easy. Troponin blood test, stress test, SCT, 2D echo, 24 hours ambulatory ECG. 24 hours like you can do blood pressure recording, sugar recording, ECG heart recording, cardiac calcium. Many people don't do this, but it's a test where you know amount of calcium in the heart, and if it is more than 400, definitely you got ischemic heart disease. Nuclear studies are very important, but unfortunately only in the big cities, that too not more than 3-4 centers. In a huge population of 20 million, 3-4 centers, but so that's the problem. Otherwise, it's very useful. CT coronary angiography. So this is very easy. Instead of doing inside the heart angiography, you do from here. That's all. Just inject the dye. It's a machine which picks up. It's a machines which have made this test. D-dimer blood test, sonography. Most of the chest pains you will need one of these tests. Right? Now, you and me, we are both going to diagnose now. Now you are a GP, you are doing video consultation. You ask the patient symptoms. How will you ask him? How will you diagnose? What is your diagnosis? How will you confirm it? We start. And male, I am giving you the history now, 58 years old. Now, average age of death in those, if that type of public will be 60. other maybe 70. Smoker, oh, finished. Family history positive. No, I will not go into details of family history positive. When I write family positive, either father or mother or father's brother or mother's brother or sister, one of these near or your brother had either a heart pain or a stent or a bypass. This is called positive family history. You are complaining of chest pain, which is cardiac chest pain, which I had explained to you in the first lecture. A cardiac chest pain is either shown like this or like this, not here on the heart, here in the chest, or like acidity but not burning, uneasiness, heaviness or pain here. So three types of pain, these are cardiac. So he complains of cardiac pain at rest. It comes and goes on. It comes and goes away after half an hour, 10 minutes, 20 minutes. 2 weeks have passed. No diagnosis has been made. So he comes to you. Doctor, what is it? What I have got? His ECG was done. Somebody did his resting ECG. It was normal. This is ECG normal, has no meaning in this patient at all. This is like angina. They are anginal pain but not on exertion, at rest. So angina at rest is called as unstable angina. And if you get angina at rest, next will be heart attack. So if it is angina, unstable angina, how will you diagnose? 24 hours ambulatory Holter ECG, finish. So whenever he gets those pain, the ECG records abnormality. Again normal ECG. Again when he gets normal ECG, one that is abnormal, you diagnose unstable angina. You ask for stress test, cardiac calcium if you want, whatever is available, and then ask for angiography. Definitely. Because this type of people will definitely need some sort of stent or something, or bypass. So only these investigations. Now here is another patient. You diagnose now, what is this? It was a male patient. He was 62 years old. 62 is very old. Family history positive. He has hypertension. He has diabetes. Many years. What more you want? And he has chest pain, and that too cardiac pain, that too here. But it comes only on exertion. For last 6 weeks. It comes only on exertion. As soon as he stops, it goes away. It's typical angina pectoris. Therefore, the previous doctors and all that, they gave him a wrong diagnosis because resting ECG is normal. You have diagnosed it without doing any test. Really speaking, we don't need any test to diagnose angina pectoris. Why? Because sometimes they can be misguiding. The resting ECG is normal, stress test can be positive, but sometimes stress test may not be positive because stress test will depend on how much movement he has done on the machine, how much pulse rate went increased on that machine. They don't need to be, otherwise there is no value. You do CT angiography. Why do you want to do CT angiography in angina pectoris? We want to see, we will definitely see narrowing of the vessels. That confirms it is a heart pain. But you want to see, is it the narrowing at a wrong place? Beginning of proximal, say LAD, beginning. Then that patient will need a stent or a heart or a bypass. That otherwise, if it is in the narrowing in the peripheral vessel, this man can live another 10 years, 20 years. But you are seeing that if it is at a wrong place, then he could get a heart attack in 1 year and die, and 2 years or die. So you made an excellent diagnosis, angina pectoris, and now here is another third patient I am showing you. Again male, 68 years old. Oh, he should have been dead long back. Family history? No, no family history. Clean, no blood pressure, no diabetes. But he gets severe left-sided pain, chest pain, to the back and front, from here to back severe pain. It doesn't cross the midline. In the front, it won't be like this, it will be like this. Pain is very severe, 1 to 2 days. By this time, 2-3 doctors have come for some cardiogram taken, this taken it. You see him, he is not allowing you to touch. It's so much severe pain, not allowing you to touch. You know the diagnosis. Herpes zoster. You spend 2 minutes in looking for the whole 2-3 vesicles, which will become 100 within 2 days. And then anybody can say it's a case of herpes zoster. So, the first few doctors who came, they took an ECG, it was normal, they were confused, then some useless investigation, X-ray, blood tests, etc. Nothing. You came and diagnosed 1 minute on a video consultation. Very impressive, very impressive. I'll show you the 4th case. You're talking on the video, and again it's a male patient, 42 years old. Family history, nobody had any heart problem at all. He had no blood pressure, he had no diabetes, and this pain was in the precordium. So in the precordium is here, not here. No. And patient is showing you, this pain comes and goes for 6 weeks, and he shows you, doctor, देखो, इधर दुखता है, इधर दुखता है, बहुत दर्द है, डॉक्टर जरूर हार्ट है, क्या है, हार्ट है ना. He is convinced it must be heart. Why? Because other doctors came, took an ECG, took an X-ray, blood test, cholesterol. You know this is not heart. So you spend time on palpation. So if his video consultation, you tell him, patient, इधर हाथ लगाओ, ऐसा ऐसा देखो कि थोड़ी कोई गांठ है, छोटी सी गांठ है, small. Neurofibroma is a small tumor, and one spot he will say, and that pain then spreads here. Or gynecomastia, you press the breast, is tender. It is one of these two, because if the pain is in the precordium, 6 weeks have passed, the local tenderness means he presses his pain, and he clean family history, no family history, no hypertension, no, because this, that's why I shown you. No, another male patient, 72 years, 72 means he should have been dead long back, and family history normal, no blood pressure, no diabetes. No smoking, nothing. But after one day in a party at night when he came back home and he complained of heaviness across the chest. Across means what? Here. Hold. This is called heaviness. So heaviness across the chest. And what is the complaint? Heaviness. And then he started sweating. Severe sweating, he will tell you. इतना पसीना आया कि कपड़ा बदली करना पड़ा. So much sweating here. And then he had a big vomit. Then they were giving coffee, this, water, this, so many things. After 1 hour, everything was alright. No heaviness, no sweating, no. And everybody said it is due to that party. What did you eat? Then he will say, I sent biryani, this, pulao, this, that. वो निकल गया उल्टी में, ठीक हो गया, दर्द ठीक हो गया, because he has now no complaint. But you have forgotten that you are talking to a patient who should have been dead long back. He is 72 years old. So the age is again the biggest risk factor. If suppose, so I'm running 90, one day I'm going to die. How will I die? How will I die? Tell me. Either I will have a stroke and hemiplegia and all that, because with headache and all that, and die of brain hemorrhage or whatever it is. Or I had some swelling which I was not looking after, difficulty in swallowing, etc. Some cancer somewhere. This is the age of cancer. I'll die of some cancer. Or heart attack. And of course, everybody wishes you should die of heart attack, because it's a beautiful death. That while talking in the lecture, then suddenly I said, and then sweating, and death is due to ventricular fibrillation, ventricular arrhythmia. So all these arrhythmia cause death, sudden death, finished. So this is the age to get heart and to die of heart. So there is no question whether he is he never drank, and they go on telling family members, कभी सिगरेट नहीं पिया, शराब नहीं पिया, कुछ नहीं किया. Family history was normal, has no meaning. His blood pressure was normal always. He had no diabetes, but he became 72 years old. So I was telling you, and the ODP, that all this drama took place, and after 1 hour he was normal. He said, "हम कुछ नहीं है, खाना की वजह से हुआ था." That is the typical history of heart attack in old people. So in this age, this does not make any difference. Does not make any difference. No smoking, no difference. It is the age, the time to die. After 70, so definite, 80 definite, 90, 100%. This is a beautiful diagnosis. Why? Because you picked up this and kept it in number 1. You take an ECG, straightforward, you will get heart attack. You can see it. Of course, more than that, we depend on blood tests of troponin. Do a blood test of troponin. Of course, the moment you diagnose, you tell them to run to the hospital. Run to the hospital. Why? Although he is 40% patient will die of heart attack, out of that 20% will die within 1 hour. So he has already survived 20%, but he still got 20% chance to die of what? Arrhythmias, complications of heart attack. So he should be shifted as early as possible to an intensive care unit. Very good diagnosis you made. I want you to go on diagnosing. Diagnose in your mind. I'll diagnose from here. We'll sit together and now this patient comes, whatever age. I don't know. He's 40 years old, 50 years old, 60 years old, 70 years old, 80 years old. I don't know. Suddenly there is acute pain. Acute pain. What is the word acute? Acute means he was alright few minutes back, and then suddenly there is pain in the epigastrium. What is epigastrium? This is epigastrium. So here severe pain he develops. This is called as acute pain. And then he starts vomiting, sweating. So see, the word acute I have used here against spontaneous, like headache I told you, the driver developed headache, spontaneous headache in the head, which means bursting of blood vessel. Finish. No other diagnosis. Here he was normal, everything was okay, and suddenly acute, in few minutes, for few minutes he develops severe pain, starts vomiting. Diagnosis is only two, either myocardial infarction, heart attack, or gallbladder problem. Now I am asking you, you are a family doctor, or you are giving consultation. There are two investigations now in this patient. ECG will show heart attack, sonography will show gallstones and gallbladder inflammation. Now, which one will you do first? I'm asking you, which one will you do first? It should be ECG first. Why? Sonography is available. That fellow can come, he says he can come in half an hour with his machine. ECG is important because if it is heart attack, then 40% chances of dying. And time, 20% in 1 hour, another 20%. So you have to first do an ECG, where you will get wall infarct. But if ECG is normal or does not or shows some vague changes, next immediately you will do sonography. Sonography, if you see gallbladder is distended, inflamed, stones, his gallbladder has to be removed. So, pain in the epigastrum. So last time in the first lecture I explained to you the areas. Precordium is this, epigastrum is this, chest pain across is this. Good, very good diagnosis. Now, 7th patient, I'm going to show you. You know, this patient is a female now. Now I'm going. You see, most of the female patients are much less liable to have all these illnesses. But here is a menopausal executive patient. After menopause, they develop more chances of getting heart attack, diabetes, hypertension, everything after menopause. And here there is an executive, means you are in that class of people where all these illnesses will be more common. Her auntie, that means sister of her mother, had a heart attack and she had died at the age of about 60. Otherwise nobody else in the family, absolutely. She plays tennis, and in the tennis you have to play single if there is no crowd. If there is a crowd you have to play doubles. So you don't get a chance for single. So she used to play tennis in doubles, no problem at all. But whenever she played in singles, she used to get chest pain. So she will get frightened. She will go and rest, sit down. And the moment she sits down, pain used to go away. This happened half a dozen times. So she wanted a checkup. But what is this? What have I got? So what is your diagnosis? Angina pectoris, simple. It's a pain, and she is a type who will get it now. She is already menopausal. 52. This is the time to get now these illnesses. You don't need any more risk factor, that smoker, alcohol, drunkard, etc. No, not required. Not required. And she is quite healthy. She plays tennis. But even then, even if you play tennis, you have already crossed 50, 52. You can get hard. Why not? Why can't you get? So you do a stress test. Her ECG will be normal, but you do a stress test, it will show abnormal changes. She has got angina pectoris. There is no question of that. Now, 9-year-old boy, he had chest pain while playing on more than one occasion. Some 6 weeks back he had, 3 weeks back again he had, yesterday again he had. Chest pain came and went away. So they want to make sure, do you think anything this boy has got? Remember that congenital heart disease is a very important entity. So, if this boy has got a congenital heart disease, so you don't waste your time by doing X-ray, ECG, this, that. Important thing is 2D echo. A 2D echo will show that maybe he has got ASD, VSD, something. All this congenital heart can be operated upon and made normal. Please remember that. Please remember that. So a good 2D echocardiographer, not an ordinary, Because a number of other people also, they say they can do, yes, they can do. But here you need a fellow who does only 2D echocardiography, nothing else, 2D echocardiographer. Then we come to case number 9. So on the video you will tell those relations. बोलते हैं हार्ट कार्डियोग्राम नॉर्मल है, हार्ट नॉर्मल है, डॉक्टर बोलते हैं सब ठीक है, लेकिन आपका क्या ख्याल है, क्या है बच्चे को? चलिए मेरा ख्याल है उसको कुछ जन्म से कोई हार्ट में तकलीफ है, ये टेस्ट कराओ, ये टेस्ट उसमें मालूम पड़ेगा, फिनिश, कंसल्टेशन इज ओवर. केस 9. Now see how origin, onset, duration, progress, see how it helps in the diagnosis. Grandfather, he was 75 years old, that means quite old, but then grandfather, he was operated for fractured leg. It was not successful operation. So he is lying in the bed for 6 weeks, and then he developed edema of one leg, swelling of the one leg. One day he complained of sudden pain in the left lower chest, left lower chest. So left chest means everybody thinks of heart. So doctor was called, ECG was taken, nothing. Now you are on video consultation. That ये वो डॉक्टर बोलता है कुछ नहीं है, हार्ट नॉर्मल है, आपका क्या ख्याल है? You tell him, get a blood test done of D-dimer. This is 100% pulmonary embolism. Pulmonary embolism is a blood clot going from the legs into the inferior vena cava and into the heart, sudden death or sudden pulmonary, in the pulmonary artery blocking suddenly, it can have sudden death. And all these people, when they suddenly die, most of the doctors write on heart attack. When I was in the postmortem room for 1 year, I saw a dozen patients in 1 year, dozen, where the patient had died suddenly and the doctor has certified that cardiac arrest, heart attack, myocardial, like that. And their hearts were normal on the autopsy. And the autopsy, young boys doing pathology, they used to do autopsy. So they would write down that, will say no cause found. I said, see, open the pulmonary artery. Open the pulmonary artery. Normally they don't open pulmonary artery in a postmortem. Open pulmonary artery, big clot. And I used to tell them, see, this is the big clot which has blocked pulmonary artery and outer are same. Outer is as big, pulmonary artery is also as big. Both can be blocked and sudden death. I should say this death was due to pulmonary embolism. Because you people don't cut the pulmonary artery and routinely on the postmortem, this diagnosis is missed, even in autopsy. And they used to be very happy. I used to teach them something, they used to teach me something. I had a lovely time learning that how pulmonary embolism is a very important cause of death, wrongly diagnosed as a heart attack. So how will you diagnose pulmonary embolism and not a heart attack? A person who has got edema, that means he has got a thrombus in the veins already, and one day this thrombus travels and goes to pulmonary artery, blocks it, and he gets a sudden pain in the lower chest. So D-dimer test, if it is very high, it's already diagnostic. So X-ray test in this patient can be useful because X-ray may show some shadow of a consolidation, collapse, fluid, whatever is the shadow, forget about it. It is due to pulmonary embolism. Because it can cause all the shadows, collapse shadows, consolidation shadows, fluid shadows. This patient needs urgent CT angiography. That is case number 9. You made a good diagnosis. Case number 10. Female, 45 years old. No, 45 is not very old. She is not menopausal. But she is a kit-kitty housewife. You know the meaning of kit-kitty, you know. Nobody will trust her, whatever she talks too much. That type of thing. Family stays clean, no family history of heart. She has no diabetes, no blood pressure. One day she developed severe chest pain in the whole chest. whole chest pain, whole severe chest pain, sweating is in the forehead, not the whole body is sweating. It lasted for 1 to 2 hours, and in the meanwhile she developed severe dyspnea. She's listening and saying, both do, but she is complaining more of pain. She doesn't understand, she's already dyspneic, she's so breathless. What is the diagnosis? Can't be heart attack. It won't be heart attack. But ECG should be done in such patient, remember that. Because after all, heart attack can have some rare presentation. And 40% death rate, you don't have to take a chance. You can do an urgent ECG, no problem. But diagnosis will be on X-ray chest. X-ray chest shows a pneumothorax. What is pneumothorax? Pneumothorax is a rupture of the lung. Normally, if it is in the autopsy, I'm showing you the lung in the autopsy, and in this lung what I find is a small here. What is this? This is a bullous, we call it bullous. It's like a small balloon. It's on the surface of the lung. Now I have removed this lung autopsy and I am showing you this. Now, many of us have got such thing in our lungs. It remains lifetime. Many of us. No trouble. But someday in some patient, this will rupture. And once it ruptures, the whole lung ruptures and the whole air goes in the pleura. So you will find that it ruptures and air comes in the pleural cavity. No, not really here. Air comes in the pleural cavity. So you will find that the lung is pushed. The lung is pushed. This is all air here outside the lung. This lung is being pushed. It will be pushed more till it is completely collapsed. So now you are working only on one lung. And whatever air you are seeing is in the pleura, it's not in the lung. Dangerous condition. And still more, it can push the heart. And the opposite lung also may not work. Patient can die. Fortunately, it's very easy to treat. Very easy. If you take this patient to the hospital and just put a needle here, the whole air comes out. Oh, finished. Pneumothorax is treated, the lung expands. But diagnosis should be made. So this is the condition is called as pneumothorax, rupture of the lung without any injury, without anything. It just happened suddenly. It can happen in anybody. And it happened in this lady who was 45 years old and she thought she had a heart attack. Everybody thought it was a heart attack. Call heart specialist, take a cardiogram. No cardiogram. Cardiogram if you want to take only to satisfy them, and X-ray will show you the pneumothorax. So here is a chest pain which is diagnosed by X-ray, not by any other test. So the usefulness of X-ray chest in the diagnosis of chest pain. Now you diagnose 10 cases, I want you to diagnose a little more. Case 11. Uncle, 51 years old, 51 and male. His uncle had a bypass at the age of 52. Uncle, not father, mother, brother, but there is a family history, there is no question of that. He is fat. He has no diabetes, no blood pressure, but he is very fond of alcohol. He is an alcoholic. And does no exercise, fat, obeys. So everybody says, "Ye karo, nahi to heart attack hoega, ye karo, heart attack hoega," but he cannot do. One day he had a heavy dinner after alcohol. And when he came back at night and lied down, on lying down he started getting retrosternal burning severe burning, retrosternal, and he had one vomit, big vomit. But with the vomit, after some time, this was relieved. He was sweating on the forehead. But the only complaint was in the last few months he used to get this little acidity, burning, off and on, at night, daytime. What is the diagnosis? Not a heart attack. GERD, hiatus. See, all these hiatus patients who have got acidity, all this acidity ultimately is from where? Acidity is, this is esophagus, this is stomach. Acidity, the acid from the stomach goes in the esophagus and you develop burning. But if this area is loose, or if this area is slightly like this, we call it hiatus, big hiatus. This area is known as hiatus, this gate is known as hiatus. So if you have got a loose hiatus, you will get all the symptoms of acidity very often. We call them GERD, gastroesophageal reflux disease. So it's a severe attack of acidity because he ate so much food and alcohol, and the cardiogram should be taken again to convince you cardiogram is normal. So you diagnose a patient which other doctors came and said heart attack. So if he is normal, but we should do troponin cells and all, admit him, watch him. You came and said, no, this is simple GERD. What is the treatment of GERD? You lose the weight, stop alcohol, stop chili, and take those pills. But some GERD, you might need some endoscopic surgical procedure. Case 12. Now, female 62. Female, but 62, then now sex has no value. Sex has no value. Her family history is plus 2 people in the family. Father's side, father and mother have had heart attack at early age. She is a diabetic. Diabetic, I told you, after 10 years of diabetes, 100% heart problem will be there. 100%. With medicine, without medicine, whatever you might tell you. She also had hypertension. And most of the diabetic patients, they don't look after the blood pressure. And in my opinion, blood pressure in a diabetic patient is more important than diabetes. More important. Those with blood pressure will develop kidney failure. Those with blood pressure will develop paralysis, stroke in the brain. So she is a very bad patient and liable to get heart. She is already crossed 60. She is already prone because of the family. She is very prone because of diabetes. She is very prone because of hypertension. And now she gets chest pain on exertion which subsides with the rest for the last 2 months. Cardiogram is normal. So the wrong diagnosis. That resting ECG has no value in this patient. Her pain comes only on exertion. So you have to do stress test, exertion, then see the ECG. The moment you do that, diagnosis is straightforward, angina pectoris. Case number 13. You are doing very well. All of you are doing very well. Eh? Very good diagnosis. Only on telephone. Only on telephone. I don't understand. Then why were you given stethoscope, blood pressure? Why did you do all those nakhras when the patient comes and all show off? That means that is all show. There is no value. What value is? History. History taking. You have it recorded in your mind, he is a male. He is 35 years old male. He is young. He should not get heart pain. He has clean family history. negative, no low blood pressure, no diabetes, yet he gets this left chest pain number of times a day. At any odd time, chest pain comes the left side, then he becomes घबराहट. He starts घबराहट कि अभी मर जाएगा, हार्ट का तकलीफ होएगा. And somebody says, comes and takes one ECG, normal, नहीं कुछ फिक्र मत करो, ये गैस होएगा, gas. No gas. We have in allopathic medicine there is no gas which causes chest pains. He has got chondritis. You can do ECG. I said ECG should be done on all chest pains. Please remember that, to satisfy him and to satisfy you. But you have to remember that I had shown you last time that you have got so much bony cage, and in this bony cage these are the ribs, and all the ribs when they start there they come here. Here they stop. The ribs stop here, and here onward this white. These are called as cartilage, costal cartilages, and again this bone is again costal cartilage. Rest are bones, and then again this thing pointing here like a tongue. This is epigastrium. Here, this is again a cartilage. So this patient, in this cartilages you get a chronic cold. Off and on you get cold and then you get pain. And suppose you get pain here, 2-3 cartilages. Naturally, you are getting pain. I am not saying you are not getting pain, and you are going to the doctor. So best thing is when you examine this patient, you can tell on the video. देखो कमीज निकालो, कपड़ा निकालो, किधर दर्द होता है, जब भी होता है, he'll show you here. अभी इधर दबाओ जोर से, दबाओ, ओ हाँ इधर ही होता है, अच्छा अभी इधर दबाओ, हाँ इधर ही होता है. So on tenderness you localize the ribs which produce the pain. There are patients who get pain only in this area, in epigastrium, and not like gallbladder, that acute pain, but all the time, and then press it, they go on pressing it. Chondritis, there is no treatment, it just subsides by itself. Some tranquilizers, some this, and assurance, this is not a heart attack, this is not a heart pain. That will be chondritis. Now, one more case 14. Male, 55 years old, heavy smoker. Heavy smoker means he will at this age 100% COPD, 110%. He will have COPD. But he goes on coughing, spitting everywhere, which if anybody asks you, oh, cigarette hai na, cigarette ki wajah se, like that they talk. No, they have got COPD. And these COPD patients, you know the life history of COPD patients, that every year they get once or twice exacerbation. Increase in the symptoms, cough increases, dyspnea increases, then fever comes, sputum becomes more, they might pass a little blood. So this exacerbation lasts for a week till you treat them properly, and it goes back to original COPD. So this patient who had this attack, for which he went to the nursing home or at home or in the hospital, developed a severe pain, and he shows with the finger here, oh, very, very severe, very, he can't breathe, very coughing, on coughing it becomes too much. And when you examine him and he says here, you press it, oh, he shouts. He's got a fracture. He's got a fracture of that rib which I showed you due to cough. So when you cough violently, one of the ribs can fracture. And the fracture, you know, any fracture will produce a lot of pain. So in this patient also, with the fracture, there is a pain. And so pain, and these are not seen on an X-ray test. X-ray test you will take, but you can't, even a CT scan, maybe you will be able to see. Not required. This is a cough fracture, apply simply Belladonna, tell your secretary, apply Belladonna plaster there. finish. So that area of the rib will not move with breathing, and in 2 weeks the whole thing heals up. Case 15. Now, male 50 years old, but I'm going to tell you, what is his complaint? What is his complaint? Onset of the fever. So now you're talking about a fever patient, not a chest pain patient. Remember that. In a fever patient, he develops severe left chest pain, increase on deep breathing, on coughing, and a little bit cough, some expectoration. Blood count has shown very high WBCs, or even if not. So what is the diagnosis? Pneumonia. How will you confirm? X-ray chest. He needs antibiotics, WBCs counts are high, he will respond within 3-4 days. He'll become alright, finish. Take an ECG and assure him heart is okay, don't worry. So once the patient comes for fever on the first day, fever can occur in heart attack, myocardial infarction on the 3rd day, 4th day, due to infarction. He is saying fever on the first day. So these are diagnosed pneumonia, chest pain, and then again female, 55 years old, alright, but fever is the main complaint, and she also have a left chest pain for 1 week. Now 1 week fever means not very high fever, but fever, and pain. 1 week going on deep breathing, she can't breathe, dry cough, and every time she coughs, again pain, no sputum, diagnosis is pleurisy. X-ray chest can show the shadow of pleurisy, but sometimes X-ray chest does not show the shadow of pleurisy, a little fluid there, with fluid or without fluid, so you have to do sonography of the chest. Sonography of the chest will show you little fluid, earliest fluid. The diagnosis is pleurisy, most of the time is due to tuberculosis. So, my friends, I want to tell you that how history taking can make you a very good doctor. How history taking can help you in diagnosis. How in history taking helps you in making a name, fame, getting more patients. I'll give you 2 examples of mine, personal examples. Sun and Sand is the name of a hotel in Bombay, where for weekend I used to go to, Saturday, Sunday I used to take my wife, we used to spend there. Why? Because all filmy people used to come there, and so they see there, it's next to the sea, next to the sea only. So Sun and Sand, swimming pool, this beautiful. One day we were in Sun and Sand hotel, and this shooting was going on, film shooting. And B.R. Chopra was the biggest producer those times. I'm talking about 1960, 70. Biggest producer. And there were so many heroes, heroines, these, that. So we were watching from the window. One of these heroes who were shooting in the afternoon or evening, not in the morning. So he had a little drink. I was told later on that he was a diabetic, he was on some tablets. And he started swimming. And then swimming, they had this first floor, second floor, jumping. He was jumping, first floor, second floor, swimming. And we saw him doing all that. And later on it seems he became quiet and a little confused. He was talking irrelevantly and a little drowsy. So the producer came, he became very, the doctor of the hotel doctor was called. ये क्या है, उसकी शूटिंग हम दोपहर को इसको शूटिंग करने की हूँ. He said नहीं वो तो डायबिटिक है और ये अभी ड्राउजी हो गया है, सेमी कॉन्शियस, तो इसके तो बहुत टेस्ट करने पड़ेंगे, हॉस्पिटल में लेके जाना पड़ेगा, वो इधर से पानी निकालना पड़ेगा, लंबर पंक्चर, ब्लड टेस्ट एंड ऑल दैट. Now the proprietor of the hotel is known to me, my patient. He said, अरे कपूर साहब ऊपर है, उनसे पूछो ना. He told B.R. Chopra. कौन? O.P. Kapoor. Oh, so immediately rang me up, B.R. Chopra. कपूर साहब, I want some help. क्या है? नहीं ये मेरा ये हीरो है, वो ऐसा ऐसा है, ड्राउजीनेस हो जाए. So I said, oh, no problem. मैं टेलीफोन दियो डॉक्टर को. I said, doctor, give him intravenous glucose. Nothing to worry. this induced blood sugar. It's a mild hypoglycemia which occurs in patients who drink and do more exercise. 1 hour he'll be normal. B.R. Chopra was very impressed. He did the shooting in the evening with the same fellow, absolutely normal. And the news went round in the whole film circle. O.P. Kapoor ने ऐसा डायग्नोस, वो बोलता है ये करो वो करो, कुछ नहीं, खाली वो दो, and he was all right. So I had a lot of clientage from film circles through B.R. Chopra. One more incident I want to tell you, diagnosed by history taking. I didn't see the patient, I didn't examine the patient. It's like video consultation. Mukesh Singer. Mukesh was a very nice fellow, a handsome, quiet fellow, sweet. But poor fellow was diabetic. Not many people knew that. He had diabetes of long duration, nearly 10 years duration. One day he developed, he went to the hospital, Bombay hospital, and said, I'm feeling very weak. I feel very weak, I feel very weak. So they did all the tests and they told him that your heart is bad. They were right. He had an old infarct in the ECG. So his heart was already involved by diabetes. But whatever treatment they gave, he didn't improve. So then he went to Jaipur, where he came from. Those doctors saw, and they said that your creatinine is 1.8, your kidneys have become weak due to diabetes, so it's due to this. He was not convinced, but what to do, treatment, what treatment? So he went to Delhi All India Institute. They top to bottom this, and they found his liver was fatty liver. Now many diabetic patients got a severe fatty liver. They said, नहीं मुकेश साहब आप शराब भी थोड़े पीते हैं, this is due to fatty liver, थोड़ी diabetes और ये आपकी drinks. He was very upset. He stopped singing. It happened that he was supposed to record 2-3 songs of Raj Kapoor's film. That time B.R. Chopra was the biggest producer on this side and Raj Kapoor on this eastern side of Bombay. So he was very upset that how will he record? He stopped singing. So he went to Mukesh, क्या है क्या, नहीं मैं कमज़ोर हो गया हूँ, मेरा लिवर खत्म हो गया, मेरा हार्ट खत्म हो गया, मेरा किडनी खत्म हो गया. क्या बात कर रहे हैं? You are looking quite fit to me. तो मेरे डॉक्टर के पास चलो. He brought him to me. O.P. Kapoor के पास चलो. He brought, and he came with so many tests from Bombay Hospital, All India Institute, Jaipur. I told them, remove all this from the table. Let me talk to Mukesh. हाँ मुकेश साहब बोलिए क्या नहीं, वो बोलते है हार्ट है, वो बोलते है लिवर. मुकेश साहब, I am asking you a question. What is your complaint? Please tell me that. I don't want to know all these things. So when I told him, what is your complaint? He got excited. क्या complaint? क्या complaint? क्या बताऊं? मैं रोज 3 पैक पीता था, अभी मैं दूसरा पैक पीता हूँ, चढ़ जाती है. अभी तो पहला पैक पीने से ही थोड़ी चढ़नी शुरू हो जाती है, मुंह लाल हो जाता है, ये बोल नहीं सकता, ये नहीं. ओह, और कोई तकलीफ है आपको? मुझे और कोई तकलीफ नहीं, मुझे कोई हार्ट की तकलीफ नहीं, मुझे किडनी की नहीं, बस आपको यही है ना. ठीक, मैं ठीक कर दूंगा. आपको डायबिटीज है ना, आप डायबिटीज की क्या दवाई खाते हैं? डायबिटीज was very popular 70s. I said this is a reaction of diabetes and alcohol. We call it alcohol disulfiram reaction. मैं आपकी खाली वो गोली बदली करता हूँ आज. अभी आपने खाई नहीं, आप ये गोली खाइए, कल से आप आधी बोतल पी लीजिए, चलिए कुछ नहीं होगा आपको. Started looking ये रिपोर्ट, नहीं रिपोर्ट वगैरह मैं पीछे देखूंगा ना. आप कंप्लेंट के लिए आए हैं, आई हैव टू रिमूव योर कंप्लेंट, सो लेट मी नो. He stopped. Next day he drank 3 packs. No symptom, nothing. And Raj Kapoor had seen it. The whole world went round the whole film industry. अरे कपूर साहब शराब नहीं पी सकते थे, पिलाया, इतनी पिलाई. I diagnose all this only on history taking. Only on history taking, remember that. The history taking you cannot complain. Sunil Dutt had fever for nearly 6 weeks and all that, and everybody doing tests those days, whatever were available, and then all blood tests, malaria, typhoid, tuberculosis, no diagnosis could be made. Ultimately somebody told him, Kapoor sahab ko bulao, O.P. Kapoor. I went there. What's the problem? I said, where were you that time? He went to Rajasthan to do shooting of Reshma Shera. He had become a producer. So 6 weeks he was in Rajasthan shooting. And as soon as he came from there, this thing started. And Rajasthan is known as the biggest malarial site in the world. It is known. So he showed me all the reports. Dr. Sahab, मुझे report नहीं. I just examined him. I said, this is malaria. Malaria के test सब 4 बार कराए, negative. No parasites. Forget it. सुनील साहब, मैं आपको खाली 10 गोली देता हूँ, वो आप 4 खाइए अभी, 2-6 घंटे के बाद 2 दिन बुखार खत्म हो जाएगा. They were looking at each other. Then I had felt a palpable spleen. You see, I am very good in spleen and liver because we people have grown up without sonography. So we can feel the spleen and all. And same thing happened. 2 days, Sunil Dutt was absolutely normal. No fever. And the news goes around in the film circle, you know. That way, my very first patient, Prithviraj Kapoor, such a fat man, 6-footer. He was running fever for 2 months. Nobody could diagnose. On those days, all investigations were done. And his friend, who was also a film actor, Mubarak, he was our landlord. He had a lot of faith in my diagnosis. One day he said, you come with me. He took me to Prithviraj Kapoor's house and said, diagnose, what is this fever due to? And so many investigations were there. I didn't look at the investigation. I only asked him, what are your complaints? And he said, fever. How much, what type of fever? And the history taking I found out that he had fever high, very high, and then for 8-10 days no fever. Then again fever, very high. During the fever he will have sweating, he will have itching. When the whole talk finished of fever, I examined him, general examination, 90% history, 10% examination, and I found in the left armpit a walnut size gland, lymph node. Finished. Diagnosis is over. So the Mubarak who took me, he said, "Kya hai? Diagnosis?" I said, he has got Hodgkin's disease. What is Hodgkin's disease? It's a cancer. It's a lymphoma. Lymphoma? तो क्या? Then Prithviraj Kapoor said, मतलब मैं अभी मर जाऊंगा? So he was a very strong personality. So I told him, we used to call Papa ji, आप अभी नहीं मरेंगे, लेकिन 1-2 साल के अंदर आप मर जाएंगे. So he said, फिर तो मैं इतनी फिल्में 10-12 pictures of small roles, I can do it when I have no fever. Yes, you do it. They took him to America, diagnosed Hodgkin disease. Now I have made all these diagnoses by history taking. That is how I became so popular in the film industry, in the 60s and 70s and all that, those days. So, ladies and gentlemen, there is, if you want to be a good doctor, first principle, good history taking. After that, 10% general examination. Thank you.